Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A better life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
Hello, everyone. It's another Wednesday morning. It's 9 o'clock. I'm Dr. Taylor. I am the hormone doctor and the spiritual MD. And I'm glad you're here with me today because, I've been doing these podcasts for just about a year. And so, this is a new year. And so, I'm going to try to adopt a new philosophy. I think this information that I'm trying to share is so basic and it is so vital to this ageless blueprint is understanding hormones. I really started this because I said I wanted to start emphasizing longevity. How can you live a fruitful, a productive life, for as long as possible? So I took the longevity course and I was like, wait a minute. What they're really focusing on is hormones. They're focusing on stress, and then they're focusing on spirituality, how we're spiritual beings in a 3D material world. So I'm like, okay, I have a background. I'm raised as a son of a Baptist minister, and my wife and I wrote 2 books: "Are Your Hormones Making You Sick?" and "The Stress Connection." And I'm like, wow, this is the key to longevity. So what we've written books. We have, I've gone, and traveled and done lectures. I've done webinars. I've done all kinds of things. We started organizations, American Functional Medicine. And, in this world, you have to adapt. So I said, maybe I should let AI take this information and try and condense it down. And maybe AI can explain it better than I can. So I used some AI tools. And I took my information and I gave it to AI and they made a video. And I'm like, wow, this is pretty good. And I said, this is something that women could take and they could share it with their friends. And it explains why they can have all these symptoms, go to the doctor, have their blood drawn, and all their blood tests be normal, and what the alternative is. And this breaks it down. And I was like, okay, hey, maybe I've been doing it wrong. I've tried all these other options. Let me try this option. Let me let AI do it. So if you can pull up this one, why hormone test misleads. So this is the crux.
Something incredibly frustrating. Okay. Have you ever gotten your...
Can you make it a full screen and you can take me off? I just want people to see this. And then you're going to be able to download this and you're going to be able to listen to it yourself and share it with other people. So let's play it. I want to make sure they can see everything in the slide, okay?
The lab results back, the doctor says everything looks normal, but you know something is off. You just don't feel like yourself. Well, today we're going to break down exactly why that happens and what those normal tests might be missing. I mean, this quote just says it all, right? And this isn't some rare one-off thing. It happens all the time. You know your body, you know you don't feel right, but the numbers on the page are telling a totally different story. It's confusing to say the least. So first things first, let's get this straight. Your symptoms, they are absolutely real. You are not imagining this. What's really going on is that the usual tests, well, they might just be looking in the completely wrong place for the answers. So how do we bridge this gap? The one between your test results and how you're actually feeling. To get there, we've got to understand how hormones work in the first place. Think of it like a little journey, just 3 simple stages. Okay, so every single hormone in your body goes on this little trip. Stage 1 is delivery. That's when it gets released into your bloodstream. Then comes stage 2, tissue action. This is the really important part. where the hormone actually gets to your body's tissues and does what it's supposed to do. And finally, stage 3 is clearance. The job's done, so the body breaks it down and gets rid of it. Simple as that. Now, out of those 3 stages, I want you to really focus on that second one, tissue action. Why? Because that's where you feel things. Seriously, all those symptoms, the fatigue, the brain fog, the mood swings, you name it, they all come from what hormones are doing inside your actual cells and tissues. So what makes this tissue stage so special? Well, a lot of our key hormones are what's called fat-soluble. And the best way to think about that is like a sponge. They literally get soaked up by your body's tissues and can just hang out there, staying active for days, long after that initial delivery in your blood is ancient history. And right there, that's the big problem. We can call it the testing gap. If everything we feel is happening down at the tissue level, then why on earth aren't our standard tests looking there? It's a great question. Here's where it all gets disconnected. When you get a blood test, you're really just getting a picture of step 1, delivery. It's like a single snapshot in time of what's floating around in your bloodstream right this second. It has no idea what's already been soaked up and is busy working away inside your tissues. And then you have urine tests. They look at the complete opposite end of the process. Step 3, clearance. So a urine test shows you what your body has already used up and is now throwing out. It's a look back at what's already happened, not what's going on in your tissues in real time. You know, this is exactly why 2 people can have the exact same normal blood test results but feel totally different. It's because we're all unique. We store hormones differently, we clear them out at different rates. Heck, even just a stressful week can completely change how your tissues react. And this isn't a bug, it's a feature. It's just how human biology works. All right, so we've got blood test for delivery and urine test for clearance. But what about the main event, that super important middle stage? How do we actually peek inside and see what's going on at the tissue level? Feels like there's a missing piece to the puzzle, right? Well, let's go find it. And this is really the million-dollar question, isn't it? If all your symptoms are bubbling up from your tissues, then we've got to find a way to see what's happening in there. So one potential answer is something called saliva testing. What's so special about saliva? Well, it measures what's known as the free bioavailable hormone. Think of that as the portion of the hormone that's not tied up. It's free, it's ready to go, it can actually get into the tissues and start working. It's basically a much closer look at what your cells can actually use. This little table really lays it all out perfectly. It's not that one test is good and another is bad. It's that they're designed to answer totally different questions. So your blood test is asking, what's being sent out right this second? The urine test asks, what's already been used up and thrown out? But the saliva test is asking the question we often care about for symptoms. What's actually available to do work inside the cells? See, once you realize they're all just asking different things, it all starts to click into place. It's not a competition between tests. It's about knowing what question you're trying to answer and then picking the right tool for that specific job. And if there's one thing you walk away with today, let it be this. The reason you might feel totally different from someone with the same normal lab results is not because there's something wrong with you. It's simply because your hormone exposure at the tissue level, which is where it really counts, is completely, totally, 100% unique to you. Okay, let's do a quick recap of the big ideas here. First, your symptoms. They're coming from the hormone activity in your tissues. Second, your standard blood and urine tests, they don't really see that part. They see the beginning and the end of the journey, not the middle. Third, saliva testing can give us a peek into that active middle stage. And finally, the bottom line is, it all comes down to picking the right tool to ask the right question for your body. So, the point of all this isn't to hand you a simple answer. It's to give you better, smarter questions to ask. Now that you get the difference between delivery, tissue action, and clearance, you can start thinking, which one of these questions is going to get me the answers I'm looking for? Which one might finally help make sense of how you really feel?
All right, Rebel. So what do you think? This is what I've been trying to get across. I used to give a lecture called Honorary Gynecologist. I can make you a honorary gynecologist in 4 slides in 5 minutes. And that's really kind of doing it. It's just a few little slides, a few little concepts. So what did you think, Rebel? Does that explain things to you? Is that something that you could share with somebody? If somebody says, I see on Facebook, they have all of these blood levels and all this stuff, and they're still confused. So what did you think about that?
Well, you have said it, and it has ingrained in me that this is just a FedEx delivery service.
Right,
So
right.
that's why the tests don't give you the results that you are
Mhm.
actually looking for. So
Yeah,
yeah, I think that was a wonderful presentation, and I think that would help because some people are audio, visual, and other learning,
yeah,
and
yeah.
this is helping them understand. Wait a minute, I finally get what Dr. Taylor is telling us.
Yeah, and sometimes if I use that neutral voice, somebody else, because sometimes when it comes from a doctor, they think it's going to be too complicated. And the other thing is, I think that people have been confused for so long. When somebody gives them a simple answer, they're saying it can't be that simple. If it's that simple, why didn't I know this a long time ago? So that's what I'm finding out when I explain it to someone. They're like, "Oh, it couldn't be that simple." So that's why I said, okay, let me do this, and it's not coming from a doctor, so it doesn't nobody thinks that I'm so smart I can understand it and nobody else can. But let me go to this next video. I want to show what people get caught up in and why it's so frustrating for the doctor and for the patient. So let's see this other, and I have it queued up, I think, at the right place. So if you can show that other video.
Where was it queued up? Because it went back to the beginning.
Oh, if you show it to me, I'll queue it up. It's in the.
Ever felt sick, but your hormone
Oh,
tests
let me
came
see.
back? Hormones are building up in your tissue a while, and then it just seems to isolation. Your tissue's stuck. You
There
get
we go.
trapped in what the source material for this explainer calls the dangerous guessing loop. And you know what this loop looks like. Symptoms don't get better, so doses get adjusted. New, complicated ratios are invented out of thin air. Estrogen levels get pushed higher and higher. And way too often, when none of that works, the patient just gets blamed for not doing it right. I mean, come on, this isn't precision medicine. It's just throwing darts in the dark and hoping something sticks. All right, so how do we get off this crazy, frustrating merry-go-round? It takes a totally new way of looking at the problem. We need a new way forward. And look, let's be super clear here. This is not about blaming
that was
doctors.
really what
Source
I wanted to
material for this
show.
explainer
Is that guessing game and that's what I see that comes to my office is they get this guessing game. Is hey, look, let's try this. Oh wow, that made you gain 20 pounds. Oh, okay, let me give you this to help you to lose the weight. Oh wow, now we did this. This happened. Oh, let me give you that. It's a guessing game because the doctors don't have the information to help you. You don't have the understanding to help yourself. And so that's why I'm just like putting this out and like, hey, everybody, look at this. So, hey, if you can put up that QR code now and we'll leave it up. And then I'm just going to try and, oh, wow, is it that big? Yeah, there we go. There we go. Hey, look, if you scan that, you'll download that video, that first one. And here's what I'm asking you guys to do. You look at it, you understand it. When somebody else comes to you, or when you see somebody on Facebook that is confused, share that video, okay? And then I'm going to show you what the next step would be. Is that once you share it, if you want to know how to get a saliva test or whatever, then I'm going to show you how you go to my school group, which is down there. And in the school group, there's a chat GPT where you can ask more questions, get more clarification about what a saliva test can or cannot do. That's totally free. If you want to get a saliva test, then that's there. Then after you get the saliva test, we give you explanations or whatever. So I'm really trying to set up a system where saliva testing can become commonplace. So now let's see how much time. Okay, yeah, let me go to my slides, and I'm just going to try and explain this a little bit further. So I'm gonna put my doctor spin on it, since we had like the AI spin. So this is all about, I'm trying to get people to stop guessing with their hormones and to understand you don't just have to throw up your hands and say, oh, I'm just going to have to live like this. And I really think that in the 40s and 50s is that when people are finally, they're done with all of these roles. They grew up, they went to college, they got married, they had their family, now the kids are gone and whatever. And now they're wondering, they're going through this menopause and men are going through this aging process, and they're trying to figure out what's next. And because they've had so much stressors and all that, they become confused. They feel like they're losing their edge and they don't know why. They keep going to the doctor, they get the blood test, and then they say, I don't know what's wrong. That's the time to do a functional test. That's why I call myself a functional medicine doc. And this is looking at the function of hormones And once you know the function, you will know how to correct the function. So anyway, clinical symptoms often defy laboratory results. The disconnect lies not in the patient, but in the compartment being measured. Hey, Rebel, I know you said you've heard this so much, you just like, doesn't everybody know this? And because I've been doing this so long, I think the same thing. Hey, everybody knows this, right? But when I go on TikTok and look at Facebook and all this, and I hear all of this information, I'm like, okay, not everybody does know this. So I got to start from the beginning. So let's go to the next slide. Oh, I can do it here. All right. So why hormone care keeps guessing? You know, they say people have to hear something 7 times before they really grasp it. So I'm going to try and say this 7 times before this is over with. So current standard of care relies on markers that do not correlate with patient reality. And let me tell you, I learned that in my residency program. We never drew blood for hormone levels. We never did, because the textbook says it doesn't. The textbook says this. And so in OBGYN, they didn't tell us about saliva testing, and we didn't measure hormones in the urine. We gave birth control pills if people had hormone problems. Okay. And then we gave antidepressants if we thought you had stress problems. We gave you sleeping pills if you had sleep problems. But all of this is due to the changes that happen, normal changes in life. And if you stop chasing symptoms and look at the function, it becomes so simple. So blood levels do not correlate with symptoms, and everybody knows that. People have had fibroids, hysterectomies, and ovaries taken out, and they've never seen an abnormal blood level. I guarantee you, because it all looks normal when you're premenopausal. It all looks low when you're postmenopausal. So symptoms arise exclusively in the tissue. So it just baffles me why we don't grasp this and why medicine doesn't grasp it. And they go through all these loops and permutations trying to make blood match the symptoms. And no matter how hard they try, it just doesn't work. And that's why they come up with all of these different protocols and all this, because they can't make sense out of the blood. And they just give up and start guessing. So you can't count. Yeah, go ahead.
They're wondering if they pump you full of stuff that they think is going to change the blood levels, is it actually making it worse?
Yes, and we're going to talk about that. When it builds up, what happens is you become desensitized to it. So I'm going to get to that, why that happens, okay? And yeah, it's what happens is after a while, it doesn't work. But I think I'm going to talk about it here, but hold on to that question. I'll try and explain it more clearly later. So here's the problem. It's all about oil and water don't mix, and that's also in that other video. So I may let you download that one too. Okay, so hormones are made from cholesterol. They're fat soluble, and what I tell you is that we all know that oil and water, they don't mix. Okay, you cannot get an oily hormone through a blood soluble or a water soluble blood, because it'll precipitate out. So you have to carry it around in something called a sex hormone binding globulin. And so I think I'll get it. So that's the problem. It gets carried around, like Rebel was saying, the FedEx truck, and it gets dropped off, and it's this delivery. It's an Uber, okay? And it gets dropped off. And it doesn't matter how many Ubers are on the street. It only matters how many people get dropped off at a certain place to do a certain job. And each hormone has a certain job, and you have to know how much is in the tissue and how they're working together to give you a good feeling. And when those two people there's too many of one or not enough of other, then the job doesn't get done correctly and you get symptoms. All right, so let's go to the next one. Okay, so total blood levels measure the potential. So here's the sex hormone binding globulin. So to travel through water-based blood, lipophilic or fat-soluble hormones must be bound to this carrier protein that is dissolvable. That's the Uber, that's the FedEx truck. The total blood count includes the bound hormones. So when you look at that, it's looking at all the bound hormones. And the bound hormones cannot interact with the receptors. So that's why you see all of this blood. It's like, oh, wow, this is totally normal. Therefore, blood measures the transport trucks, not the delivered goods, okay? So there is some free hormone there, but most of it is bound. So that's what you see as normal. So you don't know what is going on here and how much of that got in the tissue. And then this starts to try to be calculated, and we'll show this in a minute. All right. So this is the only thing that is available for the tissue, and that's only about 2%. So you got to think, if this goes from 2% to 3%, then it has gone up in the tissue by 50%, but you don't even notice this in the blood. That's the problem. All right. Now, blood is merely the transport highway. All right. We got 285 in Atlanta, and we just travel on there. I travel on there every day, but it's not much I can do in the car. And if you do, you're on your phone or whatever, you get pulled over because you're not supposed to do it. So you can't do much work while you're being transported. The key is what gets delivered, what goes into the office, what turns on the computer, what does the work. That is all done outside of the highway system. All right. So blood is merely the transport highway. High traffic on the highway, high serum levels does not guarantee that passengers are successfully arriving at their destination. So, like I said, I'm trying to make this as simple as possible. This is what matters. How much goes here? All right. Now, here's the other disconnect. So blood is looking at what's happening right at that point. And then in hours and days, it can become accumulated. All right. So just because you delivered 2 estrogens yesterday, those 2 estrogens that you delivered yesterday, they can still be there. And now you're delivering 2 more because you're taking more estrogens. Okay. So now those 2 from yesterday are there, the 2 from this, but you only actually use 1 a day. All right. So you're right, Rebel. As this becomes saturated, as more and more of this starts to try and bind to this receptor, and you don't have enough receptors to take it in, you get desensitized to it. Your body stops reacting to it at all. So a lot of times people are on hormones, and the longer they take it, the less they work. And people will come and say it worked for a while, and then all of a sudden, I experienced that when I first started doing hormone replacement 25 years ago. I thought you couldn't give too much progesterone. But then people were taking progesterone, and then they would come back and say it worked great for 6 or 7 months, and then it didn't work anymore. Then I knew you have to monitor people through saliva testing so this doesn't happen. All right. So yes, more is not always better. And the more you take of it, the more likely you are going to become desensitized to it. I hear it from men taking testosterone all the time, and women too. Oh gosh. And on Facebook, oh, this helped me so much. I have so much energy. And then about 6 or 7 months later, they're like, oh yeah, but my hair is thinning and I'm starting to get acne and I don't get the energy that I used to. That's what happened. They've been monitored by the blood. They don't see the blood level going up, but this tissue level is going up. And eventually they get diminishing returns. They get desensitization. They go back to the doctor. You know what the doctor says? Oh, they look at the blood. They say, oh, you're not absorbing it. We need to give you more hormones. So then it goes up and up and up. You get worse and worse. And that's that guessing loop that we were talking about. So when you said that doing this makes it worse, yes, because since you don't have good information, you don't know what to do. So you end up increasing the dose. I hope I didn't over-explain that, but you understand that, Rebel?
I do, but here's another question for you.
Okay.
When you go into the doctor and say, okay, so you gave me this and it did this, but here's a result of what's happening. You said about the hair loss. How do they address that issue?
They give you a drug called spironolactone to lower your testosterone, because now you're making testosterone because you don't have enough progesterone. So, the medical system is like that. They cause a problem and then they give you a solution for that problem. And
It's
then when
called
you combine
practicing
those,
medicine for a reason,
yeah,
right?
yeah, they're practicing, yeah. And then when you combine those 2 drugs, and then they give you another problem. So then you need to have a drug for that problem. And that, it perpetuates this pharmaceutical-based medical system that we have. If you give something that the body is not used to dealing with, one thing, we look at this, it doesn't know how to clear it. Okay. And so it builds up. In the same way, if your liver does not work well, it can build up. Here's the other thing. So I hear people ask me, what's the difference between blood testing and urine testing? Because all of this is out there. And this is why I'm going to tell you, I believe the saliva testing hasn't been popularized, because all doctors know how to draw blood and order blood tests. And The same way with urine. They're used to doing urine tests. They're used to checking it for bacteria. But they're not familiar with saliva testing because no one has taught it. And here's what has happened because they're familiar with this. And I really believe these urine tests, they've done great marketing to think that just because they're seeing some type of hormone in the urine, that it's telling them what is happening in the tissue, but it's not. It is telling you what has been metabolized. So if your liver works well, you're going to get a lot of urine clearance. If your liver and your kidneys don't work very well, you're not going to get much clearance. So it can build up in the tissue more. So all I'm saying is, if you want to know what is happening in delivery and what's happening in metabolism, then these tests are the ones you want. But if you want to know why your symptoms are like they are, you've got to look at the tissue level. And that comes from saliva. And I've been doing this for 25 years. I know it works. If you go to my practice website, you'll see the reviews. Most people come to my practice because they see the reviews. So those are my testimonials. So this works. And I will try any method needed to get this out to people because I think it hinders your ability to be ageless. If you are confused, I had one lady come in, she thought she had a brain tumor because she couldn't sleep. And she go to all these doctors and they didn't know what was going on. So I come in, we do a cortisol test. It shows that her nighttime cortisol is going up. I give her something to help correct that functionally. And now she's relieved. Now she can go on about her life and think about other things. But when you are wasting so much time trying to figure out what is wrong with you, and the answer is this simple, it blocks your progress. It blocks your progress in your family, in your job. So that's why I'm so adamant about people knowing this and how simple it is. So this is why somebody can have the exact same normal labs and a patient can have the exact opposite symptoms. And I see this all the time on Facebook. They'll actually show all of their blood labs and say, hey, look at this. What do you think I should do? And they're asking, not doctors, they're asking just regular people on Facebook. And they're trying to ask them, can you explain these blood tests to me? Because the doctor can't explain it. Nobody can explain it. And so they go everywhere looking for an answer and they get stuck. And that's why I'm saying, just think of all of the manpower and the productivity is being wasted because they can't answer this simple question. And that's why I'm so adamant. Hey, look, put up that scan me thing again, because I want people to download this. Okay. So why saliva testing matters, okay? Saliva is an ultrafiltrate. It contains only the unbound active fraction. The only thing that gets to the saliva. Yeah, so please scan this. Hey, look, we've got 1 more minute. So if you can put that down in the corner all the time, or however you can do it, we'll do it later, however you can do it. So anyway, this is the only thing that gets through the saliva. All of that stuff that's bound in the blood, it's in the blood and it stays there. And when you measure the blood, you see all of this hormone. You see all of this. And so, but this is the only thing that gets through. All right. So I think we got 1 more minute. All right. So it comes out of the blood. It goes through the saliva gland that is fat soluble. And then this is what we see in the saliva. So to enter the saliva, a hormone must pass through the cells of the saliva gland. So we know it got through the cell. All right. And this process mirrors exactly how hormones enter target tissues like the brain, the breast. So you say, hey, if the normal amount of stuff got delivered to the saliva gland, then probably the right level got delivered to the brain, to the breast, to the uterus, all that. So that is the assumption. And that's the same way with blood tests. When they look at your sodium and potassium, they're looking at it in the blood. But because that is water soluble, they're assuming that the right amount of sodium and potassium went to your heart and your brain and all of this. It's just looking at which compartment do you want to look at to reflect what is going on in your body. Simple as that. So it's time for a break. We're going to go to a break, and then I'm going to explain this a little bit more. And I'm going to show you an example of how easy it is to understand the saliva test. And then I'm going to take you through the process of how you can have this information for yourself. Okay, so let's go to a break.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
Hello, we're back, and great, we have the Scan Me Up. So, hey, if you came in late or you don't know what's going on, that's fine. Okay, I want you to scan this QR code. There is a video that we did that explains saliva testing, where your blood tests are considered normal and you don't feel normal. Just scan that. That's what this whole thing is about. You can turn me off right now if you don't want to hear it, but scan that and you can listen to it in your car, you can, well, whatever. But you need to listen to that so that you can finally have some clarity about why you may feel like you do as you go through menopause, as you start to age, as you start to have more fatigue and have more sleep problems, and you keep going to the doctor and the blood tests are normal, is because they're looking at in the wrong place. So please, hey, scan that, download it, share it with your friends. I don't care. Okay. Just get that information out there. If they ask you, what do I do next? I'm going to show you that. But then also tell them, hey, join the podcast, follow me on TikTok, follow me on all these places so that they can really get an understanding of how they can get clear about what's going on with them. So let's go to the next slide. All right. So we're talking about how the saliva gland mimics what is in your tissue. And that's where all of your symptoms are created. And that's where all of your symptoms can be resolved if we get this tissue level correct. All right. So the saliva aligns more closely with your symptoms than anything. And I'm telling you this over 25 years, I can 100% endorse this statement. And you can 100% endorse this, that the blood tests never show you anything. Okay. They never do. When you're talking about female hormones, when you're talking about cortisol, there was one lady on TikTok said she spent $1,000 on blood tests. They all came back normal. Did a saliva test, saw her estrogen was high, progesterone was low. We corrected it. That's the end of the story. No more $1,000 blood draws. No more taking a bunch of supplements that don't work. No more being in that guessing game where the doctor keeps increasing your dose and he tells you you're not absorbing it. All of that goes away when we stop doing this and we start relying on this. And this test does not cost $1,000. Okay, it doesn't. All right, so the right tool for the right compartment. What question are you trying to answer? Do you want to know what the total is? Do you want to know what got metabolized? And it can tell you. Now, there's information in the urine. It can tell you whether or not your resiliency is up. It can tell you whether or not you're metabolizing estrogen appropriately. Are you metabolizing it in a way that's more carcinogenic or more cancer promoting? Or are you metabolizing it in a safe way? So there is some good information that you can get from the urine, but it's not going to tell you what is happening in the tissue. And I'll debate that with anybody. And that's just plain old physiology. It's not something that I came up with. It's something that is established in the textbooks, not in what the drug company information sent me, not what on the latest study showed. Is based in physiology. So clarity comes before change. All right. So we need to stop guessing. Now, let me tell you why I talk about stop calculating. So the reason why you want to stop calculating, because what happens is that doctors are trying to make sense out of blood work. Now, I went through a whole OBGYN residency and we never calculated anything. But here's the idea. Let me show you. Here's the idea. So if you go back here, what they do is they say, okay, what is the total amount of testosterone? Let's say it's 100. All right. So then they say, well, how much sex hormone binding globulin is it? So let's say if it's 98 sex hormone binding globulin and 100 total testosterone, they say, oh, it's 2% is free. All right. So they say, oh, well, let's look at free hormone. Here's the problem. You're not measuring what was sent there yesterday. Okay. So you don't see the accumulation. That's the problem. Okay. So you're seeing this. So the calculations don't work. And they start talking about insulin resistance and this. I heard a guy on TikTok. He went through this long explanation of all these calculations of how you can try and make the symptoms and what. And it's so complicated. And I'm telling you, most of the time it doesn't work. The simple way is get someone to spit in a little tube, send it off to a lab, and it'll tell you what you need to know. I'm actually, I want to show, I got to pull this up. Let me get rid of one and I'm going to show you how easy it is to look at a saliva test. So, but let me make sure, let me see if I have any more slides. Okay, they're founded in physiologic principles. Okay, so like I said, this is not something I made up. The lipophilic nature of steroid hormones, the fact that oil and water don't mix, that you do have to have a carrier protein, you need a Uber, you need a FedEx truck, the capillary transport barrier, only free hormone can get through the blood and get into the cell. The saliva gland filters everything out. It takes away all of the sex hormone binding globulin, and all that has passed through the tissue is the free hormone. And then you look at the saliva and you say, wow, this is how much was in there. I can look at how much estrogen is there, how much progesterone is there, what is the ratio, and it's all good. So let me show you a saliva test. Let me try and find it here. Let me share screen, and then let's see if I can tell it what to share. Oh, I know what it is.
And while Dr. Taylor is pulling up, I want to remind you folks that scan the screen right now. We have the scan me up. Let me fix this whole thing. Scan here, and it will bring you to what Dr. Taylor needs you to see if you missed the video earlier in the program.
Yeah, let me find the screenshot. Well, hey, look. I'm trying to, I have it. I'm trying to figure out how I can share my screen here. Let me see. Let me just add it here. Image file. Recent. Screenshot. All right. Can you see that one? Now, here we go. You see what I just put up? Yeah. So let me show you how easy this is. Okay. So you don't have to calculate. You don't have to do anything. Oh, well, here's the one calculation you have to do. See this progesterone estrogen ratio here? It needs to be greater than 200. So this is telling you how many Ubers left off estradiol packages and how many left off progesterone packages, okay? And so there has to be 200 progesterone packages to balance out one estrogen package, all right? So 1.6 times 200 is 320, all right? Her progesterone is only 95. So she's estrogen dominant. She has too much estrogen, or she doesn't have enough progesterone to balance out her estrogen. This is usually the issue because of anovulation or because of not ovulating, because the only way you can make progesterone in a significant amount is by ovulation. So we need this number to be at least 320 for her symptoms to go away. And this is actually a 28-year-old woman who is postpartum, and she's gaining weight. She's feeling awful. Her cortisol's messed up. So you don't have to be 40 or 50. You don't have to be 60. But just think, she's 28. Her hormones are all messed up. If somebody doesn't help her quickly, she's going to be in that guessing game. She's going to try all of these things. She's already been there, because this is a year and a half later. And so this is the issue. We correct this, and now she lives the rest of her life. All right. So I'm not
But
talking about just 40, 50, 60-year-olds, but that's how simple this is. And you can give progesterone in pellets, you can give it in creams. I don't care how you give it, but this is how you monitor it. This is how you tell who needs it, who doesn't. And it totally clears it up. And once you do this test, it's so simple for you to understand it and you know what you need to do. So go
Question.
ahead, Rebel.
All right. So you say postpartum. So this woman has had a baby.
Yeah.
If she's
Mhm.
postpartum and if she's breastfeeding, anything that they give her, would that affect her breast milk for the baby? And does that
No.
change
Okay.
her saliva testing?
Mhm. No. Now she's not breastfeeding as far because this is like a year and a half later. She's not breastfeeding. Now, if you are breastfeeding and I give you progesterone at the level that I would be giving is not a problem. And here's the people why people have postpartum depression is because of lack of progesterone. Because progesterone, when you don't have enough progesterone, that's why you get the PMS symptoms, you get the anxiety, depression. And that's what happens with postpartum depression. Because when you're pregnant, the placenta makes a lot of progesterone. That's why you can be pregnant and still be happy, even though you're 60 pounds heavier than you used to be. But then once you deliver, the progesterone goes away, and now you're feeling these PMS symptoms 24/7. And that's what was happening with her. And it was actually causing a problem in their relationship. Actually, it was her husband who said, "Can you help my wife?" So he doesn't want, because what happens is a lot of things shift after you have a baby. So that's how important this is. And so now we can clear this up. And at 28, they can have a good relationship. She can be a good mother. He can be a good husband. That's how important this is. That's why I'm saying scan that. Let somebody understand that this is the solution. Okay. And like I said, I'm just so adamant about it. Any other questions or anything? But I just want to show you, and because I tell you, those urine tests, I can't even understand the urine test. The doctors can't understand the blood test, but everybody can understand this test. Okay. And then here's her testosterone. Her testosterone is totally normal. And I've shown you some other cortisol tests and show you how that can really show you why you have fatigue, why you have insomnia. I told you there's one lady who thought she had a brain tumor because she couldn't sleep. I showed her it was really a cortisol issue. She has a sigh of relief. She starts sleeping again. She starts feeling better. That's how important this is. All right. So
We have more
you
questions.
see how easy that is, Rebel?
It does seem easy, but we do have people that have lots of questions here.
Okay. All
Um,
right. Good. Great. I'm glad. So good.
during the
Mhm.
day, urine can give different levels of stuff. Is that the same with saliva?
No, so here's the thing. Yeah. When you're doing urine, they usually want you to do 24-hour urine. But really, the Dutch test, they use dried urine. So you're right. It can change. So with saliva tests, they get you to give 4 samples during the day. One when you 30 minutes after you wake up, one about 4 hours later around lunchtime, one around dinner time, and then one right before you go to bed. So that allows you to do a cortisol curve, but they also pool all of that together and they come up with an average. And I will tell you, from 25 years of clinical experience, this test correlates with symptoms better than anything I've ever done before. And I'm a trained OBGYN. Okay. So this totally correlates with symptoms. If this is abnormal, they have symptoms. If I treat them and I come back and do a retest and that ratio is 200 to 1 or even close to it, the symptoms reflect it. So yes, that is the beauty of this test. It correlates. So another question?
Yes, like with blood tests, you have to fast before. Is there a
No,
protocol
no.
for testing?
The only thing you have to do is you don't eat 20 or 30 minutes before you do the test, because let's say you eat a potato chip and it nicks your gum and you don't even know that you have microscopic bleeding. Even microscopic bleeding causes a problem. The other thing they don't want you to do if you're doing cortisol is don't drink coffee, because it'll elevate your cortisol. I really believe that Starbucks is $1 billion company because most people have low cortisols in the morning and they drink coffee because they need that energy boost because the cortisol is not doing it for them anymore. Okay, so next question.
Would that be not drinking coffee at all during the testing, or don't drink coffee 30 minutes prior to testing?
No, don't drink coffee at all during that testing. And this is what I'll tell you. If I tell a patient that they can't drink coffee and they like, oh my God, how can I live without it? That tells me they have a cortisol problem and they have to have that caffeine because they have an energy deficit. And a lot of times because doctors don't understand, and we have this trend here, this fad that women need testosterone for energy. And again, you can see that this lady's testosterone is fine, and they end up getting testosterone and they really have a cortisol problem. That's why it's important to understand the whole picture. And this, I just wanted to show estrogen and progesterone today, but cortisol is a big deal. The Stress Connection is a much more important book than my Are Your Hormones Making You Sick book. All right, so next question, because after this, I want to show you what would be the next step. I'm going to show you my school group, okay? So go ahead.
Next question is, during the day, urine can be different colors. During the day, is saliva not necessarily different colors, but does it give different results?
Again, that's why we do it over the course of the day, the 4 times over the course of the day, so we can see all of that. But this is what I'll tell you. This is what I'll tell you. The blood test is 100% inaccurate, 100%. Okay, and everybody knows that, doctors and patients. The urine can give you some information. Okay, now the saliva, I'm telling you, even if it's correct 70% of the time, is better than zero. But I'm telling you, it's probably correct 95% of the time. I can explain what's going on with you by looking at the saliva test. So anything is better than zero. All right, the urine test is better than zero. It's better than the blood test. But the saliva test is where it really is. All right, so go ahead.
The next question is, we have 4 minutes. How does brushing teeth and the different types of toothpaste affect the saliva test?
Yeah, so what I tell patients, when you first wake up, brush your teeth to get all the crud out of your mouth. So now you still got 25 minutes left before you're supposed to take that first sample, because they say take it 30 minutes after you wake up. Now, so even if you had bleeding or anything, by 25 minutes, it should have stopped. And also, if you send a sample in and it has blood in it, they can see it and they will discard the sample. All right. So as long as you follow the instructions, and the instructions are simple. Again, I think a lot of people, because I make it seem so simple, they say it couldn't be that simple, but it is. All right. So I want to do one thing. I just want to show you. What your next step would be. This is the ageless blueprint. So here's what I would like you to do. Once you scan that, go to school.com ageless blueprint about, and it tells you everything, what is going on here. And then here would be the next thing you would do. You would go to this classroom. You say start here. And then this is a Hormone Clarity chat. And you can go in here and you can ask it questions. This is free. You can ask it what a saliva test is, what it isn't, why do my blood tests look like this? You can ask it any question you want. And then once you get, say, hey, look, this is what I need to do, you can order the saliva test here. And then I'll give you a video review. I'll give you a report of what to do and what to do next and what might help you and what might not help you. If you want to become a patient, you can do that, but you don't have to become a patient. And then after that, you go to this Hormone Clarity home base where you can stay centered, where you can, even if the doctor tells you something that doesn't make sense, you can go back here and it can explain it. You can take your saliva test results, feed it into here, and it'll explain it to you over and over again in different ways, different methods. And then once you get that, then we can move on to more ageless type stuff, how we can change our mind, how we can use peptides, how we can get into the spiritual part of this. But it all starts here. And it all starts with you understanding that basic information, you guys. So I want people, it's been a year that I've been trying to do this. And I'm like, how can I make it where it's easy to understand and it's easy to know what to do next? And so if you can put that, so just start there. If that resonates with you, go to my school, start here. All of that's free. And it doesn't cost you anything until you decide to do the saliva test. And once you decide to do the saliva test, that home base is there to get you centered, because I don't want you to get the information and do it and then forget it and then you go and try something else. It's to keep you centered. All right. So if there's any other questions, you can leave it in the comments. Any last thoughts? Because I know it's time is up, Rebel.
No, that's a lot to unpack, and I hope everybody understands how important this is to listen to what Dr. Taylor is telling us. And make sure if you missed any part of the scan or anything, rewind the video. It's up there.
Yeah.
You can always get it.
Yep. And then, maybe I'll send you that QR code. Maybe we can have a link to it or whatever. I'll send that to you. Okay.
Sounds great.
All right. See you guys next Wednesday.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discover the ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.